final presenter is Sally Pipes, who is the President and CEO of the Pacific Research Institute for Public Policy in San Francisco. She was a healthcare advisor to Mayor Rudy Giuliani in his 2008 presidential campaign. Her second book, The Top 10 Myths of American Healthcare, was released in October 2008. She's originally from Vancouver, Canada. And Sally, I know that since you only have 7 minutes and 10 myths, you better get going.
Thank you, and it's a delight to be here. I am against the proposition that universal coverage should be the responsibility of the federal government. What I'd like to say is trying to understand healthcare is similar to unraveling an onion. There are many tearful moments. I do think that everyone here would agree that we all want affordable, accessible, quality healthcare for all. The question is, how do we achieve that goal? There are two competing visions when it comes to healthcare reform. One which relies on empowering doctors and patients, and the other which relies on increasing the power of government in our healthcare system through increased mandates, taxes, and subsidies. Today in America, 47% of the healthcare industry is in the hands of government, whether it's through Medicare, Medicaid, the state children's health insurance program, which has just been increased, and the VA system, the Veterans Administration system. It seems to me today that the government vision is on the rise. And as I see it, the long-term goal of most liberals in this country is a Canadian-style, single-payer healthcare system, or Medicaid for all. We are often told that systems such as exist in Canada and in Europe are cheaper and more efficient and effective than what we have here in America. Most Americans consider their healthcare system here to be good. And in a recent poll by Robert Glendon of Harvard, he showed that 82% of Americans are satisfied with the healthcare that they have. Dr. Marmer just mentioned the cost of healthcare. Today in America, 16% of our healthcare, of gross domestic product, is on healthcare. It's about a $2.3 trillion industry. And I'm not sure whether 16% is too much or too little. Americans demand the very finest in healthcare. But politicians and people in the media say we need to get that percentage down from 16%. And that is how we are going to achieve universal coverage, reduce our costs, and reduce the number of uninsured in this country. The Census Bureau said in fall of 2008 that 45.7 million Americans do not have health insurance and health coverage. We can talk later about who those 46 million people are, but 17 million of them are people who are earning over $50,000 a year and do not buy insurance. 2/3 of them are people that are young and they decide not to buy insurance because it is expensive. And young people consider themselves, like many of you here, invincibles, and why should you spend $500 a month on health insurance? 14 million of those uninsured are people who are already eligible for government programs such as Medicaid and SCHIP and have not signed up. Canada, my country of birth, and where I spent most of my career as an economist, spends about 10% of gross domestic product on healthcare and has universal coverage. If Canada has universal coverage and only spends 10% of its GDP on healthcare, why can't we duplicate that model? Well, as Brian mentioned, Canada is opening up its government-run system to private alternatives, and yet here in America, we're looking at expanding that 47% to having more government in our health care. President Obama, during the campaign, said he was going to be the health care person and he's going to bring about health care reform in this country. We heard from Dr. Fine about people who lost their insurance because they lost their job or the company changed and had only one insurance plan. But, you know, President Obama wants to beef up the employer side of health care, and I disagree with that. I think that is the problem, that we do get, most people, 64% of Americans get their health care through their employer. President Obama wants to have a pay or play plan. If you as an employer don't provide health insurance, you will have to pay a payroll tax of around 7 to 8%. There will be a new government-run public insurance plan in President Obama's plan. The government insurance plan will be part of a national insurance exchange. There will be private insurers in the exchange and the public plan. My worry is that the government plan will be priced lower than the private insurers because of guaranteed issue, community rating, and a number of other mandates. I see crowding out of private insurance and leading us down the path to a single-payer, Canadian-style healthcare system. Care will be rationed, taxes will increase significantly to pay for this, and the entrepreneurial spirit in this country will be weakened. We will have a Canadian-style Medicaid for all. Many Canadians and people from all over the world come to America, whether it's Belinda Stronach, former Member of Parliament in Canada, who opposed opening up the Canadian system to 2 tiers. But when she was diagnosed with breast cancer, she came to the University of California at Los Angeles and paid for her breast cancer surgery. It was not all right for other Canadians to have a choice, but she had a choice. While no one will deny that we have some problems in our healthcare system, I believe that markets and competition and opening up the healthcare system, providing choice, will bring about universal coverage and universal access in our healthcare system. Thank you.